Hey everyone, this is Dr. Goldberg. I just wanted to touch base via video just to give a few quick tips on the 8-step ethical analysis, just to provide a little bit of feedback and some assistance going forward. So just very quickly, two small items. The first item is you all know that you have a list of values and principles that you can use as ethical appeals to justify your particular choice. So this becomes particularly important in step 4 when you're looking at identification of stakeholder values. In step 7, when you're doing justifications, you're showing how particular values are driving selected options. We just wanted to clarify because the values and principles list it separates out some of the values you can consider and principles, and then there's probably even some talk you've seen about virtues from the basic concepts and vocabulary in session 3. The point is that all of these are basically equivalent ethical appeals. It makes no distinction for the purposes of our course and for the process, the 8-step ethical analysis, whether one is called a principle or a rule or a virtue or a value. You don't need to worry about that. Everything, all the tools that you have, all the different values and principles, they're all just ethical appeals, and you can use any of those ethical appeals in justifying a particular decision. So don't worry about whether something is fairly labeled as a principle or a rule or a value or virtue. For our work in IPED, none of that makes any difference, right? They're all just different kinds of ethical appeals that you can use to justify particular options. So we just wanted to clarify that. The other thing we wanted to touch base on regarding the 8-step ethical analysis is looking at step 6 in particular. Step 6 asks you to select an option that you will choose. And then it also says to describe any conditional factors, and actually what we've realized is sometimes there are some learners and some teams who are using the conditional factors almost as a way to sort of avoid making the choice. They say, well, I don't know whether we should, for example, withdraw life-sustaining treatment or not, but it really depends on the answer to this. And so that's just what we're going to say right now. It depends on the answer to this. If the answer is A, then we will vote to withdraw life-sustaining treatment. If the answer is B, then we will vote not to withdraw life-sustaining treatment. And the problem is we can't really get away with that in ethics analysis. And there's a reason for that. It's because basically, everybody would avoid an ethical dilemma if they could, right? I mean, nobody wants to be in an ethical dilemma. 100 out of 100 people would avoid making a difficult ethical decision by delaying it or by saying, well, I don't know what the answer is. We have to go through these steps first, and then maybe at some later time we'll figure out what the answer is. Everybody would do that because nobody wants to be caught on the horns of a difficult ethical dilemma. The problem is we can't always do that. And that's why we have, in these ethics cases, we have forced choices. We really have to decide our ultimate choice. So it's okay to state conditions that we are interested in seeing. Like, first I would talk to the family, for example, and see what they would say. But that doesn't get us out of sort of moral jail, right? What that means is we still have to answer the moral problem. We have to make a decision on what we would do with regard to the most important moral issue that was identified in step 1. And so it's just important to realize that a language about conditional factors in step 6 really isn't a way for any team or any moral agent or anyone who's working on these ethics cases to really get out of making those kinds of difficult moral decisions. We all have to, whether we withdraw life-sustaining treatment or not. That's the issue. There might be some conditional steps along the way, and it's perfectly fine to articulate what those might be, but we don't get to hedge at that point, right? Step 6 really requires you to take a position, and then you're going to go on and defend it in step 7. So I hope that clears some items up. If you'll always feel free to contact Dr. Madagoski or myself with any questions, comments, or concerns. Thanks for your hard work so far, and look forward to our next session together.